The majority of people, when they conceive of someone being poisoned by ink, picture them drinking ink from a pen. In the event that you have accidentally ingested ink, for example by biting on the end of a pen and getting ink in your mouth, there is no need for you to be excessively worried. Ballpoint pens, felt tip pens, and fountain pens contain so little ink that there is not enough to cause poisoning if it is sucked from a pen, said a report written by the World Health Organization, WHO. It's possible that some inks may make your mouth feel uncomfortable. It is possible that ingesting large quantities of ink directly from the bottle might cause irritation, although no cases of severe poisoning have been documented. If you accidentally ingested ink, the World Health Organization recommends flushing your system with water and says there is no need to take any more action. Signs and symptoms of ink poisoning. Because it comes in such a little amount and is believed to have a low toxicity level, ink from pens, markers, highlighters, and other writing instruments is often not a cause for worry about poisoning. Typical symptoms include a discolored tongue or skin, and while it's unusual, you may also have some slight stomach distress. If ink from any of these sources has been accidentally ingested, it is imperative to seek medical assistance due to the high concentration of ink found in printer cartridges and stamp pads. Toxic effects from ink left on the skin. Drawing with ink on your skin won't get you sick with ink poisoning. Although it has the potential to leave a temporary stain on your skin, ink will not poison you. Toxic effects from ink getting into the eye. In contrast to skin, the eyes are more likely to experience discomfort when in contact with ink. If you think you may have gotten ink in your eye, try flushing the affected eye with cold water until the pain subsides. Even while there is a possibility that the white area of your eye may get discolored briefly due to the ink, it is quite improbable that this will lead to any permanent or long-term difficulties. Seek medical attention if the discomfort persists or if you have a blurring of your eyesight. Tattoos and the risk of ink poisoning. A survey conducted in 2015 with 2,225 persons in the United States found that 29% of adults in the country had at least one tattoo, and of those people, 69% have 2 or more tattoos. When getting a tattoo, not only should you be on the alert for unclean methods and equipment that has not been sanitized, but you should also be concerned about the ink itself. According to the Food and Drug Administration, FDA, of the United States of America, trusted source. Infections may be the consequence of getting a tattoo with tainted ink or color, which may include mold or bacteria. The Food and Drug Administration classifies tattoo ink as a cosmetic product. There are no pigments, ingredients that impart color, that have been granted permission by the FDA for injection into the skin for the purpose of aesthetic enhancement. Reactions to the tattoo include allergic reactions and infections. It's possible that after having a tattoo, the affected region may break out in a rash. There is a possibility that it is an infectious response or an allergic reaction. The following pigments, as identified by the Mayo Clinic, have the highest propensity to result in allergic skin reactions. Symptoms of an aggressive illness might include things like the following: high temperature accompanied with sweating and shaking. Antibiotics are the standard treatment for an infected tattoo, but the patient may also need to be hospitalized or undergo surgery. What should you do if you get an allergic response to the ink used in a tattoo? The first thing you should do is make an appointment to see a physician so that he or she can diagnose and treat you. Depending on the diagnosis, it may be possible to tell whether the response was caused by the ink itself or by some other factor, such as an unclean application. The next thing you should do is have a conversation with the tattoo artist for 2 reasons. It's possible that your doctor may require specific information about the ink, such as the color, the brand, and the batch number. Your tattoo artist will want to determine the ink's name in order to prevent it from being reused. Have a conversation with your primary care physician about the possibility of reporting the occurrence to the FDA in order to facilitate the updating and dissemination of safety information. Takeaway: It is difficult to be exposed to huge amounts of the ink that is used in pens and markers, since it is only regarded to have a low level of toxicity. Therefore, there is a low probability that you may have ink poisoning if you consume ink from a pen, get some on your skin, or get some in your eye. These three scenarios all involve ink contact. More than the ink itself, the safety procedures and hygiene of the tattoo artist and shop are the most important factors in determining whether or not a person may get poisoned by tattoo ink.